Thank you for joining us today. My name is Lisa Ammon, and I serve as president of the Louisville Forum. We meet on the second Wednesday of every month at Vincenzo's Restaurant. The Louisville Forum is a nonpartisan public issues group founded in 1984. The Forum hosts debates and discussions of contemporary and somewhat controversial public policy issues that affect the greater Louisville community. Although we may take up an issue that has national interest, we try to highlight the local perspective. For more information on the Louisville Forum, our programs, or to make reservations, please visit our website at louisvilleforum.org. As a result of the Affordable Care Act, the state expanded Medicaid to low-income adults and built its own marketplace known as Kentucky Connect. The implementation of ACA in Kentucky was largely seen as a success. According to the Kaiser Foundation, research points to gains in coverage and reductions in the uninsured and increases in access as a result of the expansion. Since implementing ACA, Kentucky's uninsured rate for non-elderly fell from 18.8% to 6.8% in 2015, and roughly 440,000 adults have obtained coverage. On June 22, 2016, Governor Bevin released a waiver application called Kentucky Health, which stands for Helping to Engage and Achieve Long-Term Health, as an alternative to the current Medicaid expansion. The waiver includes many provisions which range from adding a higher deductible to offering an incentive account for dental and vision coverage. According to Governor Bevin, this will ensure the program's long-term financial stability. Our topic this month is Kentucky Medicaid. Is surgery necessary? We are honored to have guests such as Secretary Vicki Yates Brown-Glisson with the Kentucky Cabinet for Health and Family Services, John Chilton, who is the State Budget Director, Jason Bailey, who's Executive Director of the Kentucky Center for Economic Policy, and Cara Stewart with the Kentucky Equal Justice Center. Vicki Yates Brown-Glisson was appointed to Secretary of the Kentucky Cabinet for Health and Family Services by Governor Matt Bevin in December of 2015. A Kentucky native, Secretary Glisson is an attorney who has concentrated her practice in health insurance and law and served as the former chair of the American Bar Association's Health Law Section. In addition, Secretary Glisson served as president and CEO of Nucleus, Kentucky's innovative center, where she oversaw its mission of developing parks and fostering the growth of innovation research and technology companies in the Louisville area. She has served as a co-chair of Health Law Practice Group at the law firm of Frost Brown Todd. Please welcome Secretary Glisson.
Thank you all very much for asking me to be with you today. I really appreciate it, and I appreciate your presence here today to talk about a very, very important topic. As the governor told me right off the bat when I was appointed secretary, this is one of those issues that can take our state down, so we do need to be mindful as citizens here in Kentucky. When I start my remarks today, I think what I'm going to say to you is I'm going to be very blunt. I want you to know that the current Medicaid program is not sustainable. The current Medicaid program is not sustainable. Right now, the Cabinet for Health and Family Services is spending about $30 million a day, $30 million a day to pay for Medicaid coverage for our citizens. That amounts to about $1.23 million flowing through our Cabinet every hour. Medicaid also consumes about 35% of the entire state budget, 35% of the entire state budget. And in my Cabinet's budget, it consumes 83% of the budget. And I want you to know that my Cabinet is the largest Cabinet in state government, and it makes up about 43% of our state budget. What that means, in practical terms, is that Medicaid is projected to consume every new general fund dollar that is going to be coming into the state for the next 2 years, and that will impact virtually all parts of state government. Under the expansion, most folks don't understand that now almost a third of our population is covered by Medicaid. Almost a third of our population in Kentucky is covered by Medicaid. The Consensus Forecasting Group, which is a committee made up of the LRC and others, has actually predicted some good news. In the next 2 years, in this biennium of 2016 to 2018, they're projecting an increase of revenue of $585 million. However, Medicaid now is projected that it's going to have an increase in cost of $587 million, so $2 million more than we're even expecting to come in this next biennium, to just keep this program going, just to keep it going. Medicaid, as it stands today, with expansion, as I said at the beginning, is not sustainable. The Medicaid expansion, whenever it was implemented by an executive order of the former governor, it was put together with no financing plan. And the reason that was done that way is that at the time, the federal government was trying to lure states into expanding Medicaid. Because remember, under the ACA, when it was first impacted, they were going to force states to expand. Some of the states fought back. Kentucky did not. Many did. And they were able to be successful in the Supreme Court to say it will be an option with the states. They can choose whether they want to do it or not. This state chose to do it through an executive order, so our legislature had very little, if anything, to say about it. When it was done at the time, you didn't have to have a financing plan because the lure that the federal government had is that we will pay 100% of the benefits for these newly eligible individuals. We will pay 100% up until 2017. That's why we are now hitting the wall. And for the next 5 years, we're going to be paying an extra amount, up to an extra 10% up until 2020. After that, we don't know what that price tag may be. What that also means from a practical standpoint is that this unsustainable cost growth that we're having in Medicaid expansion, it also threatens our traditional Medicaid program. These are the folks that have been the aged, the blind, pregnant women, children, disabled, the ones that we feel that we know we have a moral obligation to take care of. It actually now impacts, it perhaps can impact and have an impact on that population. It also threatens to crowd out other priorities such as pensions and education, corrections, and even within my own cabinet. When I walked into my cabinet, I was stunned to find out that every penny that could be scraped from every department within my cabinet. Now, this is a cabinet that takes care of our most vulnerable folks in our state. This is the cabinet that worries about foster care, guardianships, child protection services, adult protection services. Every penny that could be scraped had been removed from those departments and had been sent over to the Medicaid department in order to try to cover up the hole that was even then mounting, because whenever we actually expand Medicaid, it covered 100% of the benefits of those newly eligibles, but it only continued to pay for 50% of the administrative cost. So when we added another 440,000 people to the rolls through the expansion, that cost has come home to roost in our cabinet. And so I have to figure out how I'm going to take care of other services for our very vulnerable Kentuckians, whether they're foster children that are now flowing into our cabinet, because somewhere in some places in our state, we're looking at 70 to 80% of the new babies that are being born in this state are being born in hospitals to opiate-addicted mothers. And they become part of our foster care system, and we have to take care of them. So our resources are very strained, and we're strained even more to try to plug in the hole at Medicaid. So this waiver, Kentucky Health, it is Kentucky specific. It's a 5-year demonstration project. We're asking the federal government, give us a chance to prove that these things can work. It's a 4-prong approach. We've taken a lot of time and effort to try to be very thoughtful about how we take what assets we do have and we align them better. We do a better job of trying to get more out of the resources that we have. So this 4-prong approach is, number one, it's an 1115 waiver. That waiver is targeted at able-bodied adults with no dependents, hoping to get them into private insurance. Then it also is targeting our substance use disorder problem, our substance abuse problem that we now have in the state. How we try to use this waiver to try to put together a pilot to deal with that problem, but try to do it in a cost-effective, but a way that we actually align our resources. How do we use our local health departments better? How do we get more out of our local health departments? How do we use our public health departments? How do we use the MCOs, the managed care organizations, that are a part of that are now managing these Medicaid dollars? We have to ask more from our managed care organizations. One of the things we did do is we went back and looked at the rates. As many of you may know, what we found is that in Kentucky, previous to this administration, the profits of those managed care entities was 11.3%, 11.3%, compared to a national average of 2.6%. We've been able to recoup another $100 million that we've been able to bring back into the Medicaid program because we're trying to be more responsible about the rates that we set for the managed care entities. We also went back and looked at the medical loss ratio. We were picking up the fact that many physicians and hospitals felt that not enough money was going back to pay for medical expenses. And so we have now closed that gap as well. So, four-pronged approach, the 1115 waiver, the substance abuse pilot project. We actually are concentrating on our chronic diseases that we have here in the state: cardiovascular disease, cancer, substance abuse, and diabetes. We can't do everything for everybody, but we can take these four big things that are our four big cost drivers, and we can align it better with our managed care organizations and our local health departments and trying to have alignment using our assets more effectively and in a better way. And then, of course, managed care reform. So, the waiver. It's actually expected to save Kentucky taxpayers a total of about $2.23 billion in the next 5 years. That amounts to about $340 million in state funds. It does not, and I want to repeat this because I think there's some confusion out there, it does not eliminate the Medicaid expansion. And in fact, it's what Governor Bevin has tried to say over and over again. It is his plan on how he can preserve expansion. This is his plan about how he can preserve the expansion. After much work and deliberation, I think as we were told, this was rolled out on the 22nd of June. We took a lot of comments. We were only had to go to 2 cities. We went to 3. We went all over eastern to western Kentucky. We got about 1,400 comments. We considered those carefully. We did make some changes, and the federal government has taken that under advisement, and they deemed it complete last week on the 8th. And so there will be another 30-day, and that was a huge hurdle for us, and we were very pleased that the federal government deemed it complete. And so for the next 30 days, up until the 8th of next month, it will be open to comments. Most of the provisions, let me just finish by saying, most of these provisions have been approved in the past by CMS, so there's nothing really new here, or they actually are provided for in the Social Security Act. So this is a transformative plan, and I think we are very hopeful that in this transformative plan that is Kentucky specific, the federal government will approve this waiver. Thank you.
And next we have Jason Bailey. He's founder and executive director of the Kentucky Center for Economic Policy. He's author of numerous reports and analysis of economic and financial issues facing the Commonwealth going back to 1998. Jason appears frequently in the media and is a regular speaker to civic organizations on policies that would move Kentucky forward. His public service includes appointments to the Governor's Blue Ribbon Commission on Tax Reform, the Kentucky Teachers Retirement System Funding Work Group, and the Kentucky Commission on Small Business Advocacy. He has a master's in public administration with a specialization in public finance from New York University and a bachelor's degree from Carson Newman College. Please welcome Jason Bailey.
Well, thank you so much for having me. Really appreciate the opportunity to be here to Louisville Forum to talk about this really important issue. And I want to say special thank you to Secretary Glisson and to Director Chilton, as well as Cara, for their willingness to engage in this conversation. Kentucky is a very unhealthy state. I wish we didn't have to say that, but it's true. Kentucky ranks at the top of most lists for cardiovascular disease, for cancer deaths, for smoking rates, for other things that we know reduce health. And that impacts Kentuckians' quality of life and their life expectancy, but it also impacts our workforce participation and the overall strength of our economy. You know, Kentucky has among the lowest workforce participation rates of any state, and our poor health is a significant factor in that. And that's why the Medicaid expansion and the opportunity that has come with that has been so big for Kentucky, and why so many folks have taken advantage of it. As mentioned, over 440,000 Kentuckians have gained coverage. Kentucky is among the nation's leaders in coverage gains. New census data out yesterday affirms that. And so people are getting coverage. But it's also the case that people are taking the steps to get healthier and to address that core not only quality of life, but economic issue. We've seen a huge increase in the preventive screenings and care that we know contribute to better health. Cholesterol screenings, cervical and breast cancer screenings, tobacco use interventions, preventive dental services. They all approximately doubled the first year of the expansion. And new research by the Harvard School of Public Health compared Kentucky and Arkansas, which expanded Medicaid, with Texas, which did not, and have found that low-income adults in those two expansion states were less likely to skip their medications, more likely to get regular care for chronic conditions, less likely to use the ER, which we know is more expensive, less likely to report trouble paying their medical bills, and very importantly, more likely to report having excellent health. So even in a very short period of time, we're starting to see the benefits in terms of Kentuckians' health, and that will have long-term implications for Kentucky's overall economy. Not only that, but the Medicaid expansion is a really good deal for Kentucky, and it's a good deal in multiple ways beyond the health benefits. You know, Kentucky is claiming a savings of over $100 million a year in the budget on monies that we previously spent with state dollars on public health, mental health, indigent care, substance abuse. Now with Medicaid, the federal government is picking up all the costs now, but at least 90% of the costs in the future. We're also pulling in $2.5 billion a year in federal monies to each because of Medicaid expansion, and that is going into our state. It's going to providers. It's showing up in job creation in the healthcare sector. As of July, there were 11,500 more jobs in hospitals and in doctors' offices and so forth than there was 2 years before. That's showing up in income tax revenues. It's showing up in sales tax revenues. And hospitals are benefiting. They've seen a reduction of almost $2 billion so far in the uncompensated care charges that go with having more people covered. So I think the Medicaid expansion is a really huge opportunity for Kentucky's economy in the short term and our health and its implications in the long term. But the waiver that's been proposed would create barriers to coverage that threatens to move us backwards on the progress that we are seeing. You know, the waiver process, what the federal government is, what we're asking the federal government to do is to waive parts of the law to make changes. And the intention of the 1115 waivers is to carry out demonstration projects, new ways and innovative ways of doing things that achieve the goals of the law. And that waiver is supposed to meet one or more of four goals: increase and strengthen overall coverage, increase access to providers and provider networks, improve health outcomes, and increase the efficiency and quality of care. And what has been proposed in the waiver, taken as a whole, is in direct conflict with these goals and would move us backwards on our healthcare progress. And this is really important. It includes measures that have not been approved in any state for that reason and will not be improved by HHS. And they've been making very loud signals that they will not do that. HHS just issued a letter to Ohio rejecting their waiver because it includes some of the same components. So the proposal includes barriers to care, and that's why these things are rejected. That will reduce the number of people covered. These work requirements, premiums with lockouts for failure to pay, elimination of retroactive coverage, escalating premiums over time, a lockout for those who refuse to sign up. It also gets rid of transportation assistance and dental and vision care as benefits. You know, these things limit cover. We have evidence from past experiments in other social service programs and in some cases in Medicaid experiments that these things don't move us towards the goals that we've experienced. So, for example, in premiums, Oregon in 2003 had a demonstration to do premiums in a lockout period, and enrollment dropped almost by half as a result of that program. Similar results in Utah and in Wisconsin. Elimination of services like dental and vision are a big problem given our poor health. You know, Kentucky's 43rd in the nation in terms of adults who say they visited a dentist in the last year. And we know that, it was mentioned about our addiction problem. Dental pain is the primary gateway to opioid addiction. We know that when California got rid of their dental benefit, ER visits for dental pain went up 68%. California went back and put the dental benefit back in place because of that. So I think that, there are multiple ways in which this creates barriers to care, and really the proposal is at odds with the reality of many low-income Kentuckians. The focus here is on work, But most of the people who got coverage because of Medicaid expansion are working. They just work in low-wage jobs where they cannot afford or are not offered health coverage. And so, I think that we have to understand the reality that many jobs don't offer coverage, and Medicaid now plays an important role in our overall healthcare system. We'll be able to talk more about some of the issues around, but I just will mention that there are significant administrative costs associated with this rather complex program. The $2.2 billion in savings that is projected, $1.9 billion that is federal money that Kentucky will be giving up that would otherwise provide care. So it's hard to see how that would benefit us. But I will stop there and say that this is a good investment for Kentucky Medicaid expansion. It's moving us forward on health. It's helping our economy. It will in the long term. We do have budget problems in Kentucky, but those largely stem from a tax system that has too many holes. And we need to address that issue and not cut back on these investments that we know pay off. So thank you very much.
All right, next we have State Budget Director John Chilton. John Chilton has more than 40 years of experience as a CPA serving large and small private businesses. He is co-founder of Mountjoy Chilton Medley, a regional accounting firm with nearly 300 professionals in Louisville, Lexington, Cincinnati, and Jeffersonville. His focus has been on domestic and international income and other taxes, and also business valuation, business acquisition, disposition, and reorganization. He has served as an advisor and an expert witness in client legal matters. Chilton graduated with a BS in accounting with focus in management science from the University of Tennessee. His credentials include certified public accountant, accredited business valuation, and certified valuation analyst. Please welcome John Chilton.
You didn't have to say 40. So anyway, it has been a while that I've been a CPA in Kentucky. I appreciate you having me here today. As you can tell from the first two speakers, there's going to be disagreement over some of these issues. I'd like to read a list of things that I think that there's agreement on. And the list includes things that Kentucky needs. We need greater workforce participation. We need better educational opportunities. We need a healthy, skilled workforce. We need to successfully address the drug problem. We need to engage in criminal justice reform. We need better health care. We need a sustainable state and local government, and we need improved infrastructure for roads, bridges, and airports. Probably very little disagreement on those issues, but there's something that's getting in the way of those issues. Two big issues are squeezing the Kentucky budget. One has to do with pension underfunding. The aggregate pension systems in Kentucky are underfunded by at least $35 billion. The annual general fund budget is a shade over $10 billion. So if Kentucky had all that money come in for 3.5 years and didn't spend any of it except to resolve the underfunding, we'd be back to even. $35 billion is the answer to many questions on priorities in state government. The other is expanding health care costs. We developed some information in our office, our economists did, that showed the squeeze that the two components I mentioned, Medicaid and pensions, are putting on the state budget. In 2008, 8 years ago, the general fund budget was 18.1% was allocated to Medicaid and pensions. 18.1%. That will grow in fiscal year 18 to 30.6%. That's an increase of 12.5% as a percentage of the budget that's anticipated to occur in fiscal year 18. Sustainability for the state and local governments, both of which are affected by the pension underfunding, is a big issue that that needs to be addressed in a meaningful and successful way. I might mention that the budget that was adopted earlier this year for fiscal years 17 and 18, if you don't know, the change anticipated, or the budget anticipated no changes in the Medicaid system. We budgeted for the amount for Medicaid as it existed earlier this year. It doesn't take into account any of these savings. So I think that there was some perception that the governor was going to go in and go whole hog on it and eliminate a lot of the budget for Medicaid. That didn't occur. It's been fully funded for fiscal year 17 and 18. But as that squeeze continues, some really bad things are going to happen. There are more retired state policemen than there are state policemen. The other categories of state employees are getting close to that too. One of the pension plans, one of the larger ones for state employees in the non-hazardous occupations, is 19% funded. They're getting close to being on a cash basis for paying retirement benefits. So these are big, big economic problems that need to be addressed. It forces choices on priorities. I think that we perhaps agreed on that list of needs, but we've got to set priorities in government just like you all do at home. So that puts the Medicaid issues in the larger context of the state and local budgets. So that's good context, I think, for the discussion that we'll have later in this session. So, good.
Okay, and last we'll hear from Cara Stewart, who started work as a new health law fellow in June 18th of 2013. A native Kentuckian and graduate of Berea College, Cara holds a JD from Solomon P. Chase College of Law in Northern Kentucky. During 5 years of practice at Legal Aid of the Bluegrass in Covington, she represented low-income Kentuckians on a variety of matters ranging from family law to consumer protection. Cara also found time to volunteer in campaigns to enact local smoke-free ordinances. Together with co-author Ryan Smither in 2012, she published a Northern Kentucky Law Review article calling for reform of Kentucky's landlord-tenant laws. Recognizing a moment of opportunity for Kentuckians when it comes to health care, Cara brings talent, experience, and energy to a new challenge. Please welcome Cara Stewart.
Hi, nice to meet you all here from behind the microphone. I'm actually looking forward to having more of a conversation with your questions. I saw some papers moving around, so I'm going to try not to repeat much of anything that we've heard so we can move into that. I'm so happy that you all are willing to show up for lunch to talk about Medicaid. At least this side of the table, we show up a lot to talk about Medicaid. Secretary Glisson and I have been at lots of the same tables, and so has Jason. We have this conversation amongst ourselves and in front of people regularly, but you're a new crowd to get to have the conversation with, and we need lots of voices very involved that know lots about what's going on with Medicaid. Because it's a big part of our health system, and all of us participate in our health system, right? So everyone at some point has to access our healthcare system. So we have to take that into consideration. At some point, everyone's going to access it. So for example, when we have these savings with the waiver, it's by covering less people, and those people might be cheaper for a year or so, like high deductible plans. You can put off going to the doctor for a year, but probably not for 5 years, or probably not for 10 years. Something will come up. And when that comes up, you have to have a plan in place. And so what we've seen is that we had a whole lot of people putting off going to the doctor a whole lot in Kentucky, right? We knew that we weren't a healthy state, but now we really know what's going on because people are going to the doctor in high numbers because we have more people covered. We had the biggest reduction in the country in uninsured. And while it's not an absolute that having coverage means that people get healthier, it's pretty common sense that that's a part of the puzzle. right? Like, and turns out that Harvard did a study and said it absolutely is. And you can make a pretty direct correlation to improved health and coverage as a minimum floor for that. And then we think about what we're going forward with the possible of waiving the rules of Medicaid to create our own project to experiment with ways to deliver healthcare services. And I'm all about that because the title of this was, does Medicaid need surgery? Yes, but so does our whole healthcare system. We need to transform the whole system, right, to be better for all of us, to have more value for everyone at every point in the system. But the proposed waiver that I hope we can discuss in some detail today, I don't think does that. I think that, like Jason said, it directly is in conflict with the requirements of the statutory authority to waive the rules because it does not expand who it covers. It does not increase networks. It does not meet any of the four sort of how the Secretary of Health and Human Services has the authority to waive the Medicaid rules. I would love to think of ways to use Medicaid to transform our health system into more value-based services. But putting barriers in place and putting that burden on those most vulnerable, and in falsely pitting populations and saying that these people are worthy, but these people aren't. All of these people are low income by definition to be eligible for Medicaid. Do y'all know what it means? It means that you are at or below 138% of the federal poverty level. Federal poverty level is around $11,000 a year, $980 a month, $940 a month. You tell me how that's your income and you are not vulnerable in some way, right? So there is no these people are and these people aren't. Everyone in that income range has got untold barriers to all parts of their life and their health for sure. And this has been one way where we're making it more possible, for people to be more productive. People who were kept out of the system for a long time, suddenly if they've got insulin and their diabetes is under control, well, they can work more. Right? And if they've got a blood pressure pill and their blood pressure stays down, much better worker than if you end up in the ER with a stroke, which is not good for any of us. So we want to keep everybody covered, everybody in preventative care and smart ways of accessing value-based care. So I'm excited to listen to your questions and have some conversation about what this proposal is and isn't. Thanks.
All right, now we'll move to the question and answer session.
Thank you. This is for all of the panel members, and we've had a number of questions that all seem to revolve around the same issue, is that if the federal government rejects the proposed plan as currently written, what do we as a Commonwealth do with the individuals who are currently on Medicaid? Is there a plan B, I guess, is what people are asking, and that for any or all of the panel members?
I'll answer it. So if the federal government rejects the proposal, which if as is, there's no doubt that they will, because the work they've said on the day the Governor Bevin had a press release, HHS responded with a press release saying that they would not approve a work requirement. So, sure. I prefer to talk and stand myself, but I was advised to wait to answer from the chair, so I apologize. So we know that, but if that happens, nothing changes. Right? So we still have Medicaid expansion as is, and nothing changes about it. So that's what would happen then. Now, of course, we've heard the governor say that he would do something, right? So, and I would expect that anybody other than me at this panel would be more qualified to speak to what that might be. But if the HHS, they don't have any control over that, right? So if they say, no, we're not going to waive all the Medicaid rules for you to do this experiment, then nothing changes in Kentucky. We keep going on our course of moving the needle and improving the overall health of Kentuckians.
And as Mr. Chilton said, the governor did put in the budget for this biennium enough funds, we believe, to be able to continue to pay for Medicaid as it currently is. So it gives I think the governor's thought around that was it gives us time and an opportunity to consider all of our options.
The other consistent question and theme in what we're receiving is just the big question, is this, what we have now currently, affordable and sustainable? I suspect there are probably a couple of different opinions there, but if perhaps all four of you could answer and address that question from your own perspectives, that'd be great.
Well, I can tell you that since coming to Frankfurt, we spent a great deal of time in trying to, and we were looking at this issue, this problem that we were now going to be facing, is that we also understood that whatever was going to be done needed to be done affordably. And so what you're going to find in the waiver is that the traditional Medicaid recipients, those that are the most vulnerable, are really not impacted by this. The targeted audience is really the expanded population that are able-bodied adults that have no dependents, and trying to help them become self-sustaining and to begin to improve their work skills, because we do have a number of provisions in the waiver that allows folks to go in and get a GED. They get points for getting GEDs that goes into their My Rewards account, a career coach, a career assessment. So the thought is that we are hoping that we can help those folks then maybe move from Medicaid into the private commercial insurance market.
I would comment in answer to the first and second question as to what happens if the waivers are not approved, none of them. The answer is that there's got to be some priorities set in the future budgets as to where we're going to spend money. If that squeeze continues, there's got to be some cuts in other areas of government. It's a matter of priorities. It's the same thing we do in our own budgets. We've got to set priorities. So the money squeeze will continue.
Could I comment? Can you hear me?
Yeah,
The mic?
yeah.
So I think that, yeah, affordability and the question of sustainability is obviously the main argument the administration is making around making changes to Medicaid that we can't afford. I just want to make, and I will say first, I appreciate the perspective that this administration has brought to the issue of sustainability in the budget. I think that they made big strides in this session in making the full contributions to pay down our pension obligations, for example, that we've needed to do for a long time. I think that in the case of Medicaid, Medicaid costs are growing faster than other government costs. But you all, I'm sure some of you are private employers, you know that private health care costs have also been growing faster than other costs for decades now. We have a problem around health care cost growth in this country that we need to address through further reforms than the Affordable Care Act was able to get to. But I think that there are things that we have not done yet in Kentucky that other states have done around helping to pay for Medicaid. For example, it was talked about how the general fund portion of Medicaid has gone up dramatically, and it has. But that's because we haven't looked at other sources. You know, Kentucky, we used to pay 2/3 of Medicaid costs were from the general fund about 10 years ago. Now it's about 3/4. Well, that's because the other revenue sources we use for Medicaid have been flat. We haven't looked at those. Hospitals pay a provider tax to help pay for Medicaid. That's frozen based on the revenues they received in 2006. Well, revenues are much higher for hospitals now. They're almost 50% higher, but their taxes, the tax they contribute, which comes back to them in reimbursements and lots of federal money coming back to them, has not been touched, and we haven't looked at it. Indiana did, and Indiana is supposed to be the model for this Medicaid waiver, but Indiana also increased, looked at the revenue side. So, I think I appreciate the approach of fiscal responsibility, but we have to look at the whole picture. Cost control, sure. Priorities, absolutely. But just like a household, you also look at your income, right? And what's happened to that and what can be done. In the case of Kentucky, we have a very loophole-ridden tax system. That's just one example of that. Very loophole-ridden tax system that keeps our revenue stream from keeping up with the growth in our economy. We need to address that, and if we do that, we can better afford these important investments in Medicaid, which again pay off over the long term.
And I'll just add that the provider tax was looked at during this process. We tried to look at every different option that might be out there. And what the problem you have with provider taxes are that, number one, the federal government, you have to be very careful because the federal government is now on to sort of that scheme about provider taxes. And so you run the risk that they could come back and try to retrieve those dollars. But also, they're still tax dollars. there's still tax dollars. You're asking the federal government now to come in and to provide some funds, and you're now going to match it with state dollars. So it's a balancing test. But I just wanted everyone to understand that I've seen some articles about that out in the newspaper. It was considered, a lot of debate was given to that, a lot of thought was given to that. Our model is a different model. Our model was not based on trying to take down more tax dollars to try to plug this hole. Even if it's federal tax dollars, that's still going to have to be matched by more state tax dollars. That was not the model. This is trying to help folks to become able to set up a system that folks can become independent and go into the commercial market when possible and if possible.
I'll just add one other side of, right, so it is a scale, right? It's not just where do we cut, it's also where's the money coming in from. And I think that's an honest way. You got to look at all of those sort of pieces. And for example, so we know the majority of people in Medicaid expansion are working. One way to almost instantly, according to the University of California, pull down like $1.7 billion is for them to all be able to work in smoke-free indoor workplaces. We don't have that in Kentucky. You got it here in Louisville. Everybody here has a nice, safe place to work with clean air. But most of the state doesn't. So like that's a way that you can look instantly reducing the Medicaid cost and instantly changing a lot of things about our state budget that cost nothing. So there's lots of pieces that would have to be looked at because, yeah, our budget needs lots of work, and I also hats off for looking at the pension. That needs to be done, and so does our entire tax system. All of these things are related. But we can't afford not to have Medicaid expansion in Kentucky. We can't afford to go back to pre-2014 when I sit down and talk to somebody and tell them, no, there's nothing for you. There's no way you can go to the doctor. Go home, make yourself comfortable. We can't go back to that. That's not smart for any part of our economy.
And let me just say that this waiver is not attempting to do that. It doesn't change the benefits that are the benefit package for those individuals that are currently that they currently have. This benefit, what we want to make sure that everyone understands is that Medicaid expansion is being preserved, and we're just hoping that folks will be able to increase their job skills because right now only 59% of the individuals in this state are even in the workforce. Only 59% of our folks in this state are in the workforce. 1/3 are already on the Medicaid rolls. We've got to have folks more engaged. We need people to be engaged in the workforce. We need them to be engaged in their health care. We need them to improve their health outcomes.
Okay, we'll move to our next question.
Thank you. This question, I believe, is for it's addressed to Mr. Bailey, but I guess Mr. Chilton could also address it. What would be the potential effect on the Kentucky economy if the current plan that we're under, the Medicaid plan, is canceled or changed? Is there any potential economic effect on the state of Kentucky?
Well, I think that there certainly would be. I mean, and it's multiple layers. One, again, is the federal money. We're talking about a minimum of $9 in federal money coming into Kentucky for every dollar we contribute. And yes, some of that is our tax dollars, but Kentucky gets a lot more back in federal money than we put in because we are a relatively poor state. So, for example, the $2.2 billion that is projected in this waiver to be saved, $1.9 billion of that is federal money that we would be giving up. So that is flowing into the healthcare sector. It's creating jobs. It's generating tax revenue across Kentucky. That would be a net loss. There are also, as I mentioned earlier, there are savings associated with having more people covered because we were paying for things through general fund dollars that Medicaid is picking up more of the costs of. For example, mental health, substance abuse. Those people, more of those folks have Medicaid, and their services are covered at least 90% with federal money now. So we would have to either pick those care costs back up or not provide those services anymore. And so there's savings to the budget we would lose, and then thirdly, there are the health impacts. Again, I think that the reason we have, one of the big reasons we have lower workforce participation, in addition to a lack of jobs in certain parts of the state, especially the eastern part, is, we have these barriers that need to be overcome, including health, including education, including, other things, folks with a criminal record and things like that we need to address. But I think when people don't have coverage, they're not going to get the preventive care they need to get healthy. This waiver projects 88,000 fewer people at the end of the 5-year period will be covered as a result. and that's going to cause higher costs down the road. They're going to be back to using the emergency room. Dental care in the emergency room is 3 times more expensive. These things, and we all pay for that. It may not show up in tax dollars, but it shows up in your insurance premium because you're paying that. So I think that some of the costs, some of the savings that are talked about are not taking into account the whole picture of the economic impact of the program and any changes to it.
I might comment that the Medicaid coverage, as I understand it, includes vision and dental care. I came from the private sector. You had to pay extra to get those coverages. The state employees' medical plans do not provide that, but Medicaid does. So in some ways, the Medicaid coverage is actually better than the state health insurance and many or most private insurances. Would there be an effect on the overall economy and the tax flow to the state? Our office has considered that. We've had trouble discovering changes in the health care economy in Kentucky compared to, for example, Tennessee that has not done the expansion, and we can't see a lot of differences in employment and the impact on the economy. Conceptually, it would seem to me there would be some effect. Adverse effect on employment, but we haven't been able to identify that. Most of the difference would be with perhaps in the health of the individuals that no longer have coverage.
It is obviously a complex issue. A couple of questions have to do with, if maybe there are polls that exist, or maybe this is more anecdotal. But as you're out in the state talking to people, maybe not people in this room necessarily, but people out in the state who are more impacted by what the decisions are going down the road with Medicaid, what's the feedback you're getting? If you could give us a little overview on what people want, people that might be most affected by the decisions.
Well, as I said, we did receive about 1,350 comments, about 1,400 comments. We looked at each of those. What we found in those comments is that, and certainly some of the comments that we heard when we were out in the state, was more about some of the concerns that we were changing the benefit package. It will, for those that are able-bodied adults with no dependents, their benefit package will be the Kentucky Employee the Kentucky State Employee Benefit Package. It's what every state worker gets. And as John mentioned, and as is in most commercial plans, there's not a dental and vision, but we wanted to make, that is in the Medicaid plan. Most people need to understand Medicaid benefits are far, far richer than the commercial plan. So these folks have been having a very rich plan. But we went back and we wanted to make sure, it's like, how can you fault the Kentucky State Employee Health Plan? That is the plan. But we wanted to make sure there was still dental benefits and vision benefits, because it's very important that those benefits still be accessible. And you can access those through the My Rewards account. So that's one of the things that I think we heard about. Folks were asking about, how can I still get dental benefits? How can I still get vision benefits? And one of the things that we changed is that we actually wanted to make sure that anyone and everyone can get access to that, and if they felt that they needed to. So we're delaying the implementation of that by 3 months. But you still can get it into your My Rewards account. So it gave people more time to build up funds in their My Rewards account so they can get those benefits. I think that there was some concerns around allergy benefits, and we also went back because I guess there was a very strong allergy lobbying group out there, and we heard a lot about that. And we just mentioned in the waiver that we were looking at maybe taking allergy out as a benefit. We have placed that back in. So I think most of it was around those 3 issues: vision, dental, and the allergy benefit, and we addressed each of those in our waiver when we made our changes and made the submission to the federal government.
I was at all 3 of the public hearings, and I will tell you that there were hundreds of people there. Was anybody able to be at any of them in this room? So there was the one in Bowling Green where a lot of people spoke. No one spoke in support of any part of the proposal. And then there was one in Frankfurt where some legislators had statements read who weren't actually there, and then pretty much nobody else spoke in support of any part of it. And then in Hazard, there were people waiting. We had to take down an extra wall in the room, and well over 100 people there, and there were maybe 2 people overall that were pretty much supportive. So there was absolute outrage everywhere in the state, and people were shocked and scared. And I have talked to people who are very concerned about parts that seem to be overlooked. Hospitals, while taking their public positions as they are, all in any kind of meeting I've been in, talk about the retroactive coverage going away and what that would mean to them. Because right now, if you show up to the hospital and you're eligible for Medicaid, but you're not enrolled, the hospital's not punished for the fact that you weren't enrolled. They're able to then enroll you, and it will pay for what you just shown up for. And the proposal takes that away. So that's a concern. And then the non-emergency medical transportation. So I was just with some people who are all on Medicaid expansion because they have part-time jobs, low-wage jobs, and they don't have a car. So unlike people in state health plan, most people who have a state health plan have a job that pays more than $1,000 a month. They have a job that pays more, that makes you be able to have a car or have access to transportation. People who are below poverty and eligible for Medicaid, below 138%, don't. A lot don't. And so then there's no way for them to get to the doctor. And so if we take away the non-emergency medical transportation, that leaves them with one way to get to the doctor, a real expensive way. Right? That all of you know. Ambulances, 911, which is not what we want people to use to get to the doctor. So, but I would say that it overwhelmingly, and the Kentucky Voices for Health, the statewide coalition, received over 800 survey responses, and I read through all of those, and they were overwhelmingly concerned. It's sort of like, yes, if you don't take the benefit package away, but if you put 2 doors and a tunnel and a twist chain to get there, it's like taking it away. Right? So if you're putting in these barriers that make it hard for people to get enrolled or stay enrolled, it's the same as taking away that package once you get there.
We actually did quantify the comments, and I would like to say that about 850 of those comments, of those 1,350, all dealt with the benefits, whether it's vision, dental, or allergy. The next closest issue, whenever we were able to quantify those comments, we're at 224 individuals. So far more folks were concerned about that, dental, vision, and the allergy piece, and that was addressed, whereas around the premium, and that was 224 individuals.
Jason, go ahead.
Just on the benefits, I wanted to comment that, the benefits that are cut in this proposal, the dental, vision, transportation, these things are connected to, are not separate issues, but are part of people's entire health. In the case of dental, for example, low-income people are more likely to have dental problems because they have a history of not having had proper dental care. And those things contribute, problems with oral health have been linked to diabetes, stroke, adverse pregnancy outcomes, cardiovascular disease. Dental cavities left untreated lead to secondary infections that can become life-threatening. So when you take that out and you're talking about a population that doesn't have a lot of money and is more price sensitive, and there are costs associated with adding it, taking money out of this account, and even understanding that you have an account, which is another issue that's arisen in other states that have done this, means they're less likely to do it. And you have all those things that then happen, the repercussions of that to folks' overall health, their ability to participate in the workforce, their ability to participate in the community, and that sort of thing. Transportation is another example. In the states that use that non-emergency medical transportation for this adult population, the biggest use is for visits around substance abuse, counseling, and mental health. Well, we know we have a substance abuse epidemic. And so if getting rid of this rather inexpensive benefit as part of the entire Medicaid program is going to keep people from getting the treatment they need to deal with addiction, then how are we helping the overall health situation of the state?
Okay, and I think Director Chilton, did you want to respond?
Yes, one of the objectives in these changes is to get Medicare recipients used to paying for their own medical insurance like we do. And there's a premium that's been imposed on some of the people in the expansion population only. Secretary Glisson, just to kind of put context on this, if you're above the poverty level, you have some money. What are the premiums for the expansion population? It's scaled according to their income above that from 100% to 138. What are those monthly premiums?
The premiums range from about $1 a month to $15 a month. Am I answering your question? Yeah, so.
$1 a month for somebody that's got some money doesn't sound like, they ought to have some skin in the game, as the governor would say.
Okay, I think we have time for one more question, and we need to make it brief. So.
All right, I think we actually have a great question for that, and this would be a yes or no question, is that the current request is for a 5-year, for the new plan is for a 5-year demonstration plan. The current plan has not been in place for 5 years. Would it be fair to let one plan run for 5 years to see if it had any increased benefits before you implement a new plan for a 5-year window? Yes or no?
This is a new waiver. I'm not aware that, maybe they're thinking about some of our other waivers that exist in the state that are 1915 waivers. Those waivers do have a 5-year period as well, but this is a completely different waiver. And so, but it is a good point. I do want to make sure everyone understands that the 1915 waivers, those are like your acquired brain injury waivers, your home and community-based waivers and so forth. Those are not impacted by this. This is only for traditional Medicaid and for the expanded Medicaid. And the last thought I would like to make sure that I leave folks with is that no one is being removed or losing their coverage under this plan. No one. It is really this plan is based on transitioning able-bodied adults with no dependents, giving them incentives, giving them the skills that they can get into the commercial insurance market. No one is being removed, no one is losing benefit, no one is losing coverage.
Anyone else want to respond?
I would just say that I think this plan, the waiver plan is modeled, it's closest to what Indiana proposed. There are 3, I think, evaluations of the Indiana plan going on right now. We don't have the results of any of those yet. So I think that the question of is it early? The whole idea of this is sort of you try these demonstrations out and you see if they work, and maybe then you scale them up to other states. So I think it's a legitimate question about is this early? It is also early in the expansion, I think, which is also what the question was asked. But I would just say that the waiver proposal itself projects a decrease in the number of Kentuckians covered, and there are measures in this that have been shown through other experiments in Medicaid or in other social safety net programs to reduce coverage. So I think what is being submitted says there will be fewer people with the waiver than without the waiver. So there are definitely people who are losing coverage, and there are definitely benefits that are being taken out that currently exist in the current program.
Based on what I do in state government, I don't have the information to answer that.
Okay. Well, I think that's time. So on behalf of the entire Louisville Forum, I want to thank our panelists for joining us today. And as a token of our appreciation, we have our signature mint julep cup for you. So we'll get one of those to each of you. I just wanted to briefly mention that we are looking for sponsors for our students. So if anyone's interested, please contact me after the meeting. And our next meeting will be on Wednesday, October 12th. And reservations can be made online at louisvilleforum.org or by calling 502-329-0111. Thank you and have a great day.